Hi everybody, I am Angela and this is my presentation on my interview with an informatics nurse. So I had the opportunity of interviewing Kenneth Wenzel. He is the Director of Clinical Informatics at Loma Linda University Medical Center. So he actually got his degree in computer science first, and that actually surprised me. He later went back to nursing school and got his BSN. He became a registered nurse at Loma Linda University, and then he was sought off by a colleague because of his background experience, and they had asked him if he wanted to work with IT for a quality improvement project. Because of his background. He later worked on multiple projects with IT, and because of this, they later just offered him a position within the IT department. He accepted, and he started to work there for about 4 to 5 years. Because he missed working clinically, he later just moved under the clinical umbrella there and then worked his way up to the position that he is in now. He told me specifically that he doesn't have any certain certifications and he didn't go back to school, but he told me that that's not the case for everybody and that everyone's different. So when discussing the value of informatics as a driving force in the delivery of nursing care at our facility, he told me the main thing and the importance is just leveraging technology to make our jobs easier. So when discussing safeguards and decision-making tools that are embedded in our patient care technologies and information systems that support safe practice at our facility, the two main things that we had both discussed were the deterioration index score and then the best practice advisory. So the deterioration index score, the DI score, is basically a notification that any healthcare worker can get whenever they open up a patient's chart, basically telling us to keep an eye on that patient, as there is a possibility that they might need a higher level of care. And then best practice advisory is basically whenever you do medication administration, it's a notification that you can get saying maybe it's a little too early to give that medication, or for example, Tylenol, you might have exceeded the milligrams given today, or there might be a contraindication of this medication. So just to notify the provider. In both of these instances, you would still have to notify the provider. So both of these safeguarding tools have ensured safe practice within our facility and have also ensured patient safety as well. Also, when discussing patient care technologies that have helped improve patient care at our facility, three main things that we discussed were telesitters, barcode administrations, and then device integration. So telesitters for sure have helped a lot, especially on my unit being the neuro unit, especially when we want a less restrictive type of restraint or sitter. Telesitters have helped a lot. It's a non-remote sitter that is watching our patient when we don't have a one-to-one sitter available to be there. Barcode administrations, especially when we want to practice safe medication administration, and then device integration, especially if there are monitors in the room, it stands for easy vital charting, and then continuous monitoring as well. And then for AccuChecks, it populates the sugar right then and there into the charting system. Especially when it comes to insulin, you just want to make sure, especially since insulin is a very controlled drug, you just want to make sure that you're administering that very safely. And then when discussing what healthcare workers rely on him to collect high quality data, the three main teams are the quality team, the magnet team, and then professional governance. So the quality team relies on him to collect high quality data just to make decisions and changes to improve care, as well as whenever the Joint Commission and then CMS come to visit. Additionally, the magnet team, whenever it's time for recertification, as well as whenever professional governance has a quality improvement project in the works. And then because we are already magnet certified, I had asked him what is his role in ensuring that we maintain that magnet certification, because one of the main characteristics of magnet is professional governance. His role is to just help professional governance in their QI projects. Additionally, just reporting certain specific data and metrics to help aid in showing our magnet story whenever it is time for recertification. So when describing his relationship with the IT department, because he has previously worked there, he does know a majority still of those who work still in the IT department. So his relationship mainly is just working hand in hand with them to develop better functionality for the healthcare workers when it comes to flow sheets, as well as with additional technologies. So my individualized question was, how do you ensure that clinical information systems you work with are both user-friendly for staff and effective in improving patient care outcomes? So I had asked this question because there's such a wide range of healthcare workers, and a lot of those healthcare workers may not be as tech savvy as others. So as the director of clinical informatics, how does one even work their way around certain obstacles like that? So he had told me that there are steps that they do to work their way around that. So the 4 steps are researching about and evaluating, 2 user testing, 3 piloting, and then the 4 the go live. So first they're going to research and evaluate. They're going to evaluate to see if that technology is going to meet the needs of the hospital. They're going to research the tool, the technology. They're going to also ask other hospitals that have been using the tool and see if it is going to meet, if it has met the needs of that specific hospital. They're going to research. They're going to continue to research. Second, they're going to do user testing. They're going to ask healthcare workers to test out the technology to see if it works. They're going to ask to provide feedback. If the healthcare worker has accepted that tool, then they're going to pilot. They're going to pilot it out to a specific unit. They're going to ask them to provide feedback. They're going to ask if any changes need to be made. And after those changes are made, then they're going to do the go live. So the go live, they're going to let it out to the whole facility. And then they're going to assess to see if the needs have been met to the whole facility. And if it has been, then they're gonna accept that yes, the technology has met the needs of the hospital and it has been fully accepted. So then every so often they are going to come back and check in to see how it's been working, and then they will go from there. Completing my interview with Kenneth for sure has impacted as I go on and pursue my master's, as I have found a new appreciation for technology. I never really appreciated technology until now in terms of nursing. Of course, like with charting for sure, but it comparing nursing now to before without technology, I can't imagine working bedside without technology. It must have been so hard back then. So just appreciating how much technology has helped bedside nurses with working a lot easier and just everything. So just appreciating that for sure. And then also just embracing and respecting the collaboration with informaticists, just honing that relationship, because it is very important, especially leading on to my third point, which is the importance of quality improvement. It's just very important, especially within our practice. You know, our practice, it's always constantly improving. We're always changing, and there's always a strive to do better and to constantly change for the better. So there's always an importance of quality improvement, and especially as a master's prepared nurse, I think it's important to participate in that. So just to do all 3 is, and to participate in all 3 is just what I have learned throughout my interview with Kenneth. So yeah, just to do all 3 and is what I have learned, and to appreciate that. And yeah, so thank you guys for tuning in, and I hope you guys have a good day.